But today I want to talk about the first, and that is the hot spots, and I want to talk specifically about our nursing homes. As you know, a large number of our deaths in Ohio from COVID-19 have occurred in regard to nursing home patients. Nursing homes contain some of the most vulnerable members of our society, based, of course, on age, but also based on medical condition. So I have asked my team and challenged them to work with the Ohio National Guard, local health departments, local hospitals, to go after this problem. And so we're going to start this week, and we talked a little bit about this last week, but we're starting this week a new plan and a new effort, and it involves, I'm very proud to say, the Ohio National Guard and General Harris. We're standing up what we're calling congregate care unified response teams. These will consist of, I believe, 10 members. Will be up to 14 different teams. They will start testing in nursing homes this week. The National Guard will be doing the swabbing. Advanced work for this will be a combination of the local health department, our Medicaid and health departments at the state level will be involved as well. And so what they will do is to go into a nursing home, do the advanced work, and then that will be followed by the National Guard coming in and doing testing. Who is going to get tested? The goal will be to test all staff. So all staff will be tested. In regard to the residents, the testing of the residents will be based on assessment. Clinicians, as I said, the advanced team will go out. They will assess the situation at the nursing home. They will make a determination, maybe if there's a certain part of the nursing home that should be tested. In some cases, maybe all the nursing home should be tested. But this will be a decision that's based on clinically driven a strategy that targets those that have likely been exposed to COVID-19. We are going to start with the nursing homes that have had an experience of COVID-19, either currently ongoing or in the past several months. To kind of give you the big picture, there are 960 nursing homes in the state of Ohio. Approximately 200 of these have a COVID history. And so my only order to our team has been to deploy the resources we have as quickly as we have and to focus on the goal of saving the most lives that we can. And so this is clinically driven. This is medically driven. Clinicians will be making these assessment decisions. The Guard will come in and then take the test appropriately based upon those instructions. So again, we will see that start this week. It will be an ongoing process. So we're not sure how many homes will be done every week. We will give you a report as we move forward, but this will be a continuation process that will go on for certainly for a number of weeks. And the targeting of what homes to go into, again, is based on what the clinicians think is the best and the most likely that they can save the most lives. So all homes, our goal is to have all nursing homes tested. We fully realize, and we always say this, Dr. Acton always says this, and I'm sure she'll have some comments after I get done, but testing, nothing magical about testing. It is a tool. It is a tool, and it's a snapshot in time. So when you go in and people are tested, it tells you who is testing positive now. And this, again, is particularly important. Although all nursing homes are have been deploying for some time, since we started this, the best practices that we have talked about, where they're determining if a staff member, for example, is ill. But as we have learned, and it's driven home to us every day, there are a lot of people out there who are positive, are in all likelihood, contagious, and yet they have no symptoms. And so that is why, one of the reasons that why this testing is in fact important. So this is a new phase. We begin it today, begin it this week, and we will be reporting back to you at least once a week exactly how that is going. Let me also announce also this week we will begin the testing of all residents and staff members of the state's developmental centers. This is an important effort to try to limit the spread of COVID-19 in these congregate care settings. Again, medically trained members of the Ohio National Guard will be at the state's 8 developmental centers this week to test residents and their staff. And so that is, again, something that will occur this week, and we believe should be, in all likelihood, completed this week.